Well, the new normal is what we need to do before everyone is vaccinated. And as you know, that will take some time, and we cannot wait for that. And that's what we have implemented some testing protocol for people to be able to travel and prove that they don't have COVID, and be able to move across countries that require that certificate of that testing. Now, there are some protocols also that have been developed and will stay even after the vaccination, because we need to make sure that what happened during 2020 with this global outbreak doesn't happen in the future. So we need to learn from this situation. And the third one that we believe is very important, the private sector is very united. We came up with the protocols. For instance, the hotels are offering, as an example, doctors and nurses rooms for free, and they have been able to maintain those installations COVID-free. That knowledge went to the protocols that are implemented in hospitality. However, we still need to have some coordination among countries. If you travel from one country to another one and the second country does not accept the test that it was performing in your country of origin, then that's a hassle and that's a complication. And that's what that international coordination is very important in order to resume international travel before the vaccine is widely spread and available everywhere around the world.
Right. And obviously, it's been a very difficult year for the travel and hospitality industries. In your report, you estimate that nearly 197 million people will lose their livelihoods in these specific sectors. How much of that do you think is permanent, and how much of it do you think will come back next year once activity does start to pick up again?
When we published that estimation of 197, that's when we didn't have domestic recovery in some markets. Now the latest is between 143 and 174. A lot of those jobs, unfortunately, will be impacted for a longer time than others. Let's remember that 1 in 10 jobs in the planet, that's a contribution from travel and tourism. So we have seen some good domestic recovery in some markets. For instance, China has fully recovered. Some countries in Europe have recovered domestic. Some countries in Asia have recovered domestic. However, there are still a lot of countries that they haven't. And then international is still down. And that's why some millions of livelihoods have been impacted. In Europe, for instance, to give you an idea, is 14 million jobs have been impacted so far. Depending on the measures that they implement in the next couple of weeks, a lot of those jobs are going to be gone forever or might be recovered next year. So we will see. But it's the same situation in the US and other markets. So again, if we can resume international travel, that would help us to bring back those jobs and livelihoods that have been unfortunately impacted due to COVID.
Gloria, every country has taken a slightly different approach when it comes to foreign travel. And I know that Dubai, the UAE, and the Caribbean, a couple of examples of places in the world that have opened early to international travel, foreign travel, and they become popular destinations for people in countries like the United Kingdom. What is the early indication as to how those countries are faring, having opened up to foreign travel at this point?
What you say is very important, because if you ask me what is the biggest challenge of this outbreak, of this situation, analyzing the last 90 different crises that we have had in the world and that have impacted travel and tourism, I would say the biggest challenge is the lack of coordination among countries and sharing best practices, knowledge, and information. Now, some countries, as you say, have opened up earlier and they have implemented some protocols. In the case of Dubai, for instance, they opened a corridor between Dubai and London. It's working quite well. To give you an idea, 2 million reservations have been made. And also Dubai implemented some very strict and good protocols, which means that you have to wear the mask, you need to have that social distance, and their cases are very low. Similar to some other countries like Greece, for instance, that when you look at the numbers are very low. They have used a lot of technology and information, AI, especially for that. So countries are doing better than others, but we have seen that when they are ready to open, if they open correctly, they can still reduce the spread and be able to travel and bring back these millions of jobs impacted. The challenge is when the country is open and they are not ready, or when they don't follow the protocols. And as for instance, I live in London, and I can tell you that here has been a challenge to respect the protocols, that there has been a lot of community to community transmission. In some places, people don't wear masks, or they don't have this physical distance, or we don't follow the recommendations from the health experts. So it's not about the time frame, it's the how countries are opening and the collaboration that they have among each other.